So what we found is there are different classes of gastric and esophageal cancer, especially different classes of gastric cancer, where the fundamental way in which these cancers get started are quite different. For example, there are some cancers that have underlying them a defect in their ability to repair DNA, and these get lots and lots of DNA mutations. These are cancers that are called microsatellite unstable. And we've seen that there are some intriguing targets that are sometimes mutated in these cancers, and we also see that these cancers often have higher expression of some of the markers that may suggest benefit to new immunotherapies. We've already seen in colon cancer that colon cancers with microsatellite instability also tend to do well with immunotherapy. By contrast, there are other gastric cancers that initiate in part because they're infected with the Epstein-Barr virus, the same virus that causes mono and the same virus that's implicated in a number of head and neck cancers. And these cancers, as well as the MSI, have high expression, in some cases extremely high expression, of some of the markers that can indicate possible response to immunotherapy. And there are other cancers that their foundation is a different type of genomic instability than you see in MSI. MSI tumors have lots of point mutations, but there are other classes of gastric cancer that have really abrupt and marked chromosomal aberrations, where you get sort of mixing and matching in different pieces of chromosome and many, many copies of certain cancer-promoting genes. And so in those, there are a number of different genes that get overexpressed and amplified that are often targeted by some of the either existing or emerging inhibitors. And so as you see, sort of there's different classes of cancers where the underlying mechanism of how these tumors emerge is different, and in that setting there may be, our thinking is there will increasingly be different ways to develop therapies, and maybe even that looking at existing therapy in light of these changes might help us understand where existing therapy may be more or less effective.